And so I want to talk about booster shots. We continue to work towards fully vaccinating our country. We have to plan ahead, and we have to ensure a robust and effective system for any booster shots that might be needed in the future, particularly for some of our vulnerable populations. So Dr. Jan, some early research is showing promise for immune-compromised patients such as organ transplant recipients who have increased, they need to have increased antibodies to fight COVID after a third dose, possibly, of the vaccine. More reporting has just recently come out about this. So has the research determined what a sufficient antibody level would be to provide protection? And is there currently a standard testing protocol for healthcare providers to test their patients, especially the most vulnerable, to see what those levels are and if, in fact, they might need the booster?
I'm aware of the recent research that was published that in patients, specifically solid organ transplant patients, where when they received a third vaccination dose, that they had almost a 50% increase in their antibody response. What level is protective is outside of my area of expertise. My specific environment that I work in, University Medical Center in New Orleans, which serves an underserved patient population and patients that are immune compromised, we need the answer to these questions to know how to take care of these patients better, and we look towards the experts in giving us those answers.
Yeah, I think it's really important for us to be able to have the scientists tell us what those levels are so we can determine the next case and if we need a booster, when we need it. And
Senator, I'll say that there's a lot of really great research going on as we analyze the small number of breakthrough cases to existing vaccines that will help us establish what that correlate is. They'll test people, have a breakthrough, and see where their antibodies are. That data taken together allows us to see what the number is we should watch for that tells us what protection will be long term.
yeah.